If you are planning to relocate to the United Kingdom to practice as a mental health nurse, then you must be aware that you are needed to sit for the competency-based test. So in today's video, I'll be taking you guys through the practice test for mental health nurse provided by Pearson VUE. And I'll be showing you guys how to go through this, how to answer the questions, in order to pass these exams at your first try. Now, without wasting much time, let us dive right into the video. Okay, if you are seeing me for the very first time, hi, welcome and welcome back. If you're a returning subscribers, my name is Samuel. On this channel, I make content around nursing, lifestyle, music, and some other interesting bits here and there. So in today's video, we will be going through the Pearson VUE practice test. So this is basically like a mock test preparing you for your CBT exam. And if you go through this and some other bits to read, then you should be able to pass your test. Okay, so I'll be going through it now, and if you need to practice for yourself, the link will be in the description or comment section for you. So let's go into it, guys.
By the way, if you have not subscribed, you can do so now, because my YouTube algorithm says 82.9% of you guys have been watching and enjoying my content but refusing to subscribe. Please just do so. It will greatly help me a lot. Thank you.
As always, it is important for you to read the instructions. Please make sure you go through all the instructions and see how you are to answer your questions. Now, we can see that we have 15 questions to practice with, and this is basically to help us get familiarized with the style of the question, the level of difficulty of the questions, the format of questions and answers, the buttons on the screen, the timer and screen count, the time review screen, which is shown at the end of the exam. Now, you are able to review answers after you have answered them all, and you have 30 minutes for this, and you have 15 questions. That is 2 minutes for each question, which, that is so much. So let us go into it, guys. What is the volume that has been drawn up into the syringe? Please use the correct unit and write your answer to 1 decimal place. So as you can see here, this is 3 and this is 3.1. So we're just going to put in 0.1 ml. Next, what is the volume that has been dispensed? Please use the correct units. This is already given. We can see that it is in 25, so we're just going to go ahead and write 25 ml. Kindly take note of how I'm putting my ml. That is how you should do yours as well. A patient has been prescribed 0.75 gelfusin. What is the volume in mil? We know that 1000 milliliter is 1 liter. So we are going to multiply this by 1000, and if you need a calculator, it's right here by the screen. You just click on it. 0.75 multiplied by 1000. 750. So that makes our answer to be 750 ml. In this situation, you are already given your ml, so you don't need to put in any unit. A patient has produced 1500 ml of urine in 24 hours. What is the volume in liter? This is 1.5 liter. I hope you understand how I got that. It was just the opposite of the previous question. Let me just quickly go back so that I can show you guys. This is divided by 1000, that is 1.5. And like it says in the instructions, you don't need to put multiple zeros. So make sure you read the instructions very well before you start answering your questions. So, and we are given our units, which is in L, liter, so you don't need to put that in as well. Okay, the next question says, a patient has been prescribed 500 micrograms of benperidol. How many tablets should be administered? 500 micrograms, and we are given benperidol, which is 250 micrograms per tablet. So how many 250 is in 500, which is 2. So we are given 2 tablets. Now let us go to the next question, guys. A patient has been prescribed 30 mg of amitriptyline hydrochloride solution. What volume should be administered? Please use the correct units. Now, this person is given 25 mg, which is for 5 ml, and it means that 5 mg is 1 ml. So, since 5 mg equals 1 ml, how many milligram makes 30? That is 30 divided by 5, which is 6. I actually know that it's 6. Yeah, so we are given 6 ml. If you are not so sure about that, you can go ahead and cross multiply, and that will give you something like 25 milligram equals 5 and 30 milligram equals X, and that will be 25 milligram equals 5 and 30 milligram equals X, and that will be 30 times 5 divided by 25. 30 times 5 divided by 25, which is actually 6. Okay, just for you to know that the answer is correct. So we are given 6 ml. Again, we are not giving unit here, so I can put it in. A patient has been prescribed 1.25 gram of amoxicillin suspension. What volume should be administered? Please use the correct units. Now, 1000 milligram equals 1 gram. So this is 1000, this is 1.25 milligram. So we're going to multiply it by 1000 first, times 1000 equals 1250 milligram. So no, we are going to divide this by 250. So when we divide this by 250, it equals 5. So 5 times this 5 will give us our answer. Again, if you don't understand how I did this, you can just go ahead to do a cross multiplication. That would be something like there's no place for me to type here, but that would be something like 1250 equals X, 250 equals 5, and you cross multiply. So that would be 1250 equals X. So that would be 1250 multiplied by 5 divided by 250. So 25. You can see I used 2 different methods and I arrived at the same answer. And don't forget to put in your units as well. So let's go to the next question. A patient has been prescribed levetiracetam suspension at a dose of 15 milligram per kilogram. The patient weighs 60 kilogram. What should be administered? So in this kind of situation, you have first to get the dosage to be given. So we know that our patient weighs 60 kilogram and the dose is to be given 15 milligram per kilogram. So we are going to multiply 60 by 15, and that will give us the dose to be given. 60 times 15 equals 900. And our dose, the medication is given as 100 milligram per 1 ml. So I don't need to explain too much. You know that if 100 milligram equals 1 ml, then 900 milligram equals what? 9 ml or 9 ml. So I'm going to put in 9 ml. Now next. Let me be honest with you guys, I just came back from work right now and I could show you my bags and my things down there. I was feeling so sick and I just said, okay, I need to shoot some videos because I'm doing some 30 days challenge, and I didn't even prepare for this, and I just picked up my laptop and I just did this. And if I could do them and be getting everything, which I hope I do at the end of this, then you can definitely do it. It's not hard, it's not difficult. Don't let anybody scare you. Okay, let's move to the next question. A patient has been prescribed 50 mg of flupentisol decanoate. What volume should be drawn up for the injection? Please use the correct unit and write your answer to 1 decimal place. This medication is given in 100 mg in 1 ml, and the person is to take 50 mg. So that is just half of 1 ml, and half of 1 ml is what? 0.5 ml. And take note, it says 1 decimal place, so you are not putting 0.50, it's 0.5 ml. Okay, so 0.5 ml, 0.5 ml. Next, a patient has been prescribed 100 mg of cyclizine lactate. What volume should be drawn up for the injection? Now this is the opposite of what we just did now. This one comes in 50 mg per 1 ml, and we are to give 100 mg. So that means we are giving 2 of this, which is what? 2 ml. So you can see these questions are very simple. They are very simple, guys. The next question says, a patient has been prescribed tobramycin at a dose of 3 mg per kilogram. The patient weighs 95 kilogram. What volume should be drawn up for the injection? Now we're going to do the same thing, multiply 95 by 3. And that is equals what? 285. Now, this comes in 100 milligrams. So what you're going to do is 285 divided by 100. Take note, the answer says to give your answer to 2 decimal units. That should give you a hint of what your answer would be like. If you don't understand how I got 2.85, it's basically dividing this times this divided by this. So 2.85 ml. Then next, so this is fluid rate. All you have to do is to divide the volume that you have been given by the duration it's supposed to go for. At what rate would you set the infusion pump to run? So that is 300 divided by 6, which is 50. Oh, you see, I just tried to make, we're already given the units, ml per unit. So for doubting Thomases around us, let me just divide this for them to see that it is right. Yeah, 50. The next question. Again, 250 divided by 3. I don't want to waste our time too much reading. So all you have to do is the volume divided by the duration. 250 divided by 3 should be like 120. Okay, no. The instruction says to give your answer to the nearest whole number. That is 83.333. So what is our nearest whole number? 83. Next. At what rate would you send the infusion pump to run? Again, it is 600 divided by 5. That is 600 divided by 5, which equals what? 120 ml. Next. Okay, we have come to my favorite part. So in this place, it says complete the following fluid balance charts by calculating if the patient has gained or lost fluid over a 24-hour period. If the patient has gained fluid, you should include plus before you balance your answer, e.g. plus 100 ml. If the patient has lost fluid, you should include minus to balance your answer, e.g. minus 100 ml. So what we have to do now is to calculate all the input. We have 50 plus 100 plus 50 plus 80 plus, this is 125 times 2 times 4, which is 500, I hope. Equals 780. ml, and then we're going to add all of this together as well, all of the outputs. So that is 75 plus 130 plus 180 plus 190 plus 200 plus 60 plus 75, 910 ml. So judging from what we have right now, we can boldly say that the person has lost fluid, but we just need to get our final answer, and that is minus 780, so which is 130. So the balance is what? Minus 130 ml. Oh, question 1 is incorrect. How? Anyway, we got 14 out of 15, which is good. Now, if you failed anyone, you can just review. Let me see. What did I? Oh, it is 3.2. It's because each of these is 2. So I'll just change that. Oh God, I think it was because I was so stressed. No. Okay, now we got everything. So you can see that it is very simple, and please take note of every simple things so you do not fail. Now, like the thing is supposed to be for 30 minutes, but I think I finished it in like less than 20 minutes. So I wish you the best, and don't forget to check out the clinical aspect of the mental health Pearson VUE practice test coming up. And I hope you like this video. Comment, share and subscribe, and share this video to somebody who you know that you will find it helpful. Okay, so let us dive right in. So this is what your screen will look like, and then we're just gonna scroll down. You know, these are like basic instructions, but let's just scroll down to select what we want, and you can see there are different aspects here. And don't forget, I've done the part A, which is the numeracy, so if you missed that, make sure to check that out. It's just a few videos back. Today we're doing the clinical part of mental health nursing, and this is just like, you know, clinical questions, so we should not be doing much of calculations. I don't think we should be doing any calculation, to be honest. Okay, so make sure to read these instructions because it is very vital in preparing. Right, so I just discovered my microphone was not working, and you know, we need to give you guys the best. I need to give you guys the best. Okay, now that is sorted. All right guys, so this is what your screen will look like. You will be given instructions, and you know, but this is basically just to prepare you for the exam, like I've said earlier. Now let's go into the main practice test. Which of the following describes a quantitative method of research? You are to choose the correct answer. Now we have things here on the screen which you should take note of. Like, you can flag a question for review if you are not so sure. Don't forget your time and the number of your questions. Then over here we have the calculator, which we will not be needing. Then we have over here the objective, which is like just to help you, give you a hint of the answer, basically just to like give you an idea of what the question is aiming for. Okay, let me click on this objective for you to see. Demonstrates an understanding of research methods, ethics and governance in order to critically analyze, safely use, share and apply research findings to promote and inform best nursing practice. So the question says to describe a quantitative method. That is something that can be quantified. So we know that it is not reviewing published research. It is not exploring a phenomenon by interviewing participants. It is collection of numerical data, because that is the only thing that can be quantified in these given options. Then what are the 4 themes of the NMC code? Choose the 4 themes of the NMC's code. Choose the correct answer. I am working on a video like preparatory materials for this exam, so that I tried doing a live session, but I wasn't my best that day. So I'm thinking of like doing a much detailed video. So option A says prioritize patients, practice within your limits, preserve others, promote well-being. No. Prioritize yourself, practice with pride, preserve health, promote the NHS. No. Prioritize staff, practice safely, preserve well-being, promote health. No. D says prioritize people, practice effectively, preserve safety, promote professionalism and trust. Yes, that is our answer. The third question says, when caring for a patient who is Jehovah's Witness suffering a severe hemorrhage, what do you consider? Choose the correct answer. We know that Jehovah's Witnesses do not like to receive blood. So option A says they are not to be sedated. Option B says they are not to be resuscitated. Option C says they are not to receive blood or blood products. Option D says they are to be cared for by professionals who are JW. Option C is our answer. Actually, this question seems somehow similar to the one for adult nursing. When caring for a patient who does not speak English, how do you obtain information from the patient? Choose the correct answer. So option A says to find the information you need from medical notes. No. Option B says to use a face-to-face or online translator. Option C says ask a family member to translate. No, because that's like you are like breaching a privacy, if that's the right way to put it. Then ask patient to draw pictures. No. So our best option is to use a face-to-face or online translator. Next question says, when a drug error occurs and the patient has been assessed for any harm, what is the next priority? Choose the correct answer. We have option 1, which says continue your drug round. Option B says inform patient of what has happened. Option C says call the patient's family, and option D says to continue to administer the next dose. Of all the things here, after being assessed for harm, you need to inform the patient of what has happened, and I believe in assessing for harm, the doctor would have also been informed, or pharmacist, or just to seek advice. And our most correct option would be to inform the patient of what has happened. Our next question says, the HPV human papilloma vaccination prevents which disease? Choose the correct answer. A says ovarian cancer, B says testicular cancer, C says bowel cancer, and D says cervical cancer. So I think our best option would be ovarian cancer. Then we'll just go on to the next one. Which of the following professions are specifically trained in smoking cessation? Choose the correct answer. We have option A, hypnotherapist, option B, pharmacist, option C, dietitian, option D, chiropractor. So hypnotherapist, we know is a big no. Pharmacist, well, they offer medications that can help battle nicotine addiction. Then we have dietitians, then chiropractors. So our best option is pharmacists. So which of the following diseases is notifiable to Public Health England? Choose the correct answer. Option A is mumps, option B is influenza, option C is human papillomavirus, and option D is Clostridium difficile. I was thinking it's Clostridium difficile, but I guess the correct answer should be mumps. Okay, the next question. Which of the following is a health visitor's responsibility? Choose the correct answer. A, giving emergency first aid and treatment in a crisis. B says supporting physical and emotional growth of a child. C says administering immunizations. And D says assessing speech and language development. So I think our correct answer should be given first aid, emergency first aid and treatment in a crisis. What are the common complications of uncontrolled blood sugar levels in diabetic patients? Choose the correct answer. First one says retinopathy, peripheral vascular disease, renal failure, joint pain, urinary incontinence, peripheral vascular disease. Oh, I think the A is our best option. A doctor requests a lactate test to be taken from a very unwell patient. What type of sample is taken? Choose the correct answer. I think that should be the blood gas. Scale 2 on the NMC 2 chart is used for which patient group? So that is people with like carbon dioxide retaining, people with respiratory issues. So option A says those receiving intravenous therapy. Option B says those with a urinary catheter. Option D says carbon dioxide retaining patients, and that's our answer. Then D says those who have been exposed to carbon monoxide now. Next question says patients with chronic pain conditions are screened for which of the following? Choose the correct answer. A, coronary heart disease, B, schizophrenia, C, bowel cancer, and D, low mood and depression. So I think it should be coronary heart disease, but then I'm thinking it could be low mood as well, because people with low mood could pretend to be having, or they could think they are having pain even though they are not. So I will just go with low mood and depression here. Which of the following groups has the highest rate of suicide? Not children under 18, not women, elderly over 75. No, it's men. I'm 100% sure it's men. A patient presents with a productive cough, low saturations, high respiration rate, raised lactate with NMC 2 of 9. Oh my god. Productive cough, low saturations definitely seems like chest sepsis, not bowel obstruction, because the person should be having constipation. Not deep venous thrombosis, because that means you should see engorged veins on their lower limbs. Not myocardial infarction, because they should be having, I think, shoulder pain, left shoulder pain mostly. So chest sepsis. Prior to surgery, how long are oral fluids withheld? Choose the correct answer. So I think for this question, our correct answer is 2 hours. Over here in the UK, it's 2 hours. Which group of drugs are used in patient-controlled analgesia? Choose the correct answer. So this question is a mind twister. What they are basically saying is, which group of medication belongs to controlled medications? We have option A, which is steroids, option B, paracetamol, option C, non-steroidal anti-inflammatory, option D, opioids. And we know the only listing here is opioids. So we go to the next question, which says, patients who are put on furosemide are warned of which common side effect? Choose the correct answer. So furosemide is also known as what? Lasix. And I'm so thrilled with how nursing in America and some other parts of the world practice nursing almost similarly to the way it's practiced in Nigeria. It's mind-blowing. When I say that, let me not digress too much. Anyway, so we have option A, which is constipation. Furosemide causes frequent urination. So I think our answer here should be polyuria, which is our option D, not diarrhea, not oliguria, not constipation. And I hope we both know what all this means. Constipation, difficult stooling, oliguria, scanty urine, diarrhea. So the next question. You have a patient who is choking. You have administered 5 back slaps with no success. What is the next step? Choose the correct answer. 5 abdominal thrusts. Give 5 more back slaps. Start basic life support. Monitor the patient. We know after back slaps, it's abdominal thrusts. So our correct answer is A. You are caring for a patient who has stoma formation and they are ready for discharge. What advice do you give the patient? Choose the correct answer. A. Clean with water, trying to keep fecal fluid from skin to minimize irritation. Wait until the bag is full before changing it and clean with soapy water. Use perfumed soaps to aid odor control. Keep the area moist when changing the bag. Advocating the use of oils to help the surrounding skin. I think the best option is to clean with water and to try as much as possible to keep fecal fluid away from the skin to minimize irritation, because if there's no fecal fluid, the leakage, if it's well cleaned, there won't be any smell, there won't be irritation. So our best answer for this question is option A. Next question says, what is the responsibility of an occupational therapist? So an occupational therapist, A, assess injury or damage in a patient. Assessing someone's ability to see, definitely not. Supporting people whose health may prevent them from completing their normal activity. D, reviewing and adjusting prescribed medications. I most certainly think that our best option is option C. Whose role is it to lobby to the government to support nurses and make positive change to the profession and working conditions? Choose the correct answer. A, the individual team of nurses. B, the human resources department. C, the chief executive of the trust. And D, nursing unions. I think it should be nursing unions. Yeah. What does it mean to... I honestly feel like this is similar, honestly. So, what does it mean to performance manage an employee? Choose the correct answer. A, developing a person to fulfill the expectations of their role. B, when someone is being dismissed from their workplace. C, when performance is exceeding the expected level. And D, when a person is promoted. I think the correct option here is A, because it's like they're trying to see where you may have shortcomings and like help you maximize your potential. So the best answer for this question is option A. When running a ward or unit, which of the following is the priority at the start of the shift? So at the start of the shift, one thing you need to do is to make sure you have enough staff for your patient ratio. That's it. That is it. I've not even checked the options, but I know that A says calling and updating family or carers on patients' conditions. No. To give out the breakfast, no. Check the staff numbers match patients' acuity. Yes. You don't need a doctor on the ward. When supervising a student nurse, when do you deliver feedback? Choose the correct answer. Option A says midpoint at the end of a placement. Option B says feedback is provided by the university, so you don't need to deliver this. Option C says continuously throughout the placement. Option D says at the end of the placement. So feedback is to be given continuously throughout the placement, continuously. What is a whistleblowing policy? I've talked about this in some of my previous videos, and a whistleblowing is like, you just doing a sort of biberon of the bad things that is happening in the place where you are working, but you're like trying to like cover yourself. So a whistleblowing policy sort of like protects you and helps keep you safe, basically. So option A says a major incident policy, no. Option B says a policy that helps employers manage staff, no. Option C says a policy that guides staff on raising concerns about safety and practice. I think that's our answer. When undertaking research, what is the first step? Choose the correct answer. It's to have a topic. Yeah, option B. It's to have a topic. There's no no discussion. I know that's the right answer. So what is the main purpose of a root cause analysis? When you are doing root cause analysis, you are trying to find why something is happening so that it does not happen again in the future. Basically, a tree is getting spoiled, it's getting dried up because it's not being watered, or a flower is getting dried up because it's not being watered. You're trying to like find out why is this flower getting dry. You know that it's because it's not being watered. So you water it so it doesn't dry up anymore. And in that way, you prevent that from happening ever again. Okay, so let me go through the options now to see. Option A says to assess if those involved require compensation, no. To identify who was responsible for the incidents and performance manage them. Option C says to provide data of the incident to know. Option yeah, to ensure that reoccurrence is avoided. That is our answer. Who will notify an emergency department that a major external incident has happened? Choose the correct answer. This is a tricky question, don't let it confuse you. So the option A says the hospital press lead, no. Option B says the nurse in charge of the department. Option C says the reception lead, no. The best options should be the ambulance service lead, because they are the ones that are like in charge of those emergency, major external, because it's the ambulance that will inform them like we have an incident somewhere and we need you to go there, probably bring them to the hospital, or just see if they can be managed at home without bringing them to the hospital. So yeah, D is the best option for this question. When noticing that a colleague is suffering from low mood and depression, what actions should be taken? Choose the correct answer. So the first thing you are supposed to do is to make sure you speak to them first. You see what is wrong with them and see how you could probably help them in some way. You don't just go ahead and report, which unfortunately does not happen. It does not happen. Most people will just go and report you once they see you are like in a low mood, or if they ask you what's wrong and you open to them, they just go ahead and report you to the management. I don't know about care NHS because I've never worked in NHS and I've never really had such discussions with people in NHS, but I know this kind of things happen in care homes. So let's just go through our options and see. Option A says to provide and support and guide them to well-being services. Option B says to contact their next of kin and discuss. Option C says inform their manager without telling the colleague. Option D says refer them to occupational health without discussion. Yes, so based on what I said earlier, our best option is option A. What has been implemented to ensure that nurses are fit to care holistically for patients with a variety of conditions? Choose the correct answer. So option A says ensuring students have maths and English GSCE. Option B says Royal College of Nursing online modules. Option C says new pre-registration education standards. Option D says preceptorships training. So I think it's the new pre-registration education standards. Who is in attendance at a child protection case conference? Choose the correct answer. I don't know, but I think it should be option A says the team supporting the parent or carer on lead. No, I think it should be all those involved with the family from health, education and social services. I think so. What document could help a nurse understand the preferences of a patient with dementia? We have A to be the most recent discharge summary. No. B says the patient's drug chart. No. C says a handover sheet. No. And D says a this is me document. Yes. A this is me document is basically like their CV. Let me put it that way. Like it entails everything about your resident. So the next question says, who should be notified when attending hospital with a school child aged 8? Choose the correct answer. A, the police, no. C, local children's center, no. C says school teacher, and D says school nurse and public health community nurse team. I think it should be the school teacher, honestly. I'm not so sure, so I'll just flag for review. Next question says there is a requirement to increase nursing staff on a ward due to an increase in patient demand. What steps are taken? Choose the correct answer. A, ask them to increase their working hours. Obviously not. B says reduce the number of, no. C says go directly to human resources and ask them to recruit. No. D says a business case is written to increase nursing staff numbers. I think D, yeah, D still sounds more reasonable. When failing a student for professional values, what steps are taken before the end of placement? Choose the correct answer. A says a midpoint interview where you give feedback and allow students to develop an action to plan. B says no steps required as long as the fail is documented clearly in the assessment document. No. C says inform your line manager so they can inform the student. No. D says contact the university and get them to inform the students they have failed the placement. No. So I think the best answer is A. Which of the following is a framework used to identify areas for development? It's SWOT, I think. SWOT or SWOL. Don't ask me the full meaning. According to Rogers' theory of nursing, which of the following are described as core conditions to effective communication? Choose the correct answer. It's congruence, empathy, and respect. B says sympathy, respect, and regard. No. C says empathy, respect, honesty. No. D says spiritual understanding, sympathy, congruence. No. So our best answer is congruence, empathy, and respect. Motivational interviewing is best described as dash. Choose the correct answer to complete the sentence. A says a tool used in appraising staff for development. B says a method of assisting people with health behavior change. C says a method used to encourage people to adhere to discharge advice. D says a tool used in peer supervision. I'm a little bit confused, to be honest. I'm not so sure. But I think I would go with A and let us flag for review. Next question says, what is the best method of delivering advice to patients with a new diagnosis of a long-term condition? Choose the correct answer. A says advise the patients to look up any questions about no. B says information and diagnosis is given by a consultant, so questions can be answered effectively. I don't think so. Ensure there is a range of materials available and present for the patient to take home after the consultation. Yeah. D says give all information at once. I think C is the best option. Not too sure though. ANTT refers to dash. Choose the correct answer to complete the sentence. So it is aseptic non-touch technique, which is our option C. Which of the following is not considered to be an aerosol procedure? And we've talked about aerosol procedures and we say something that has to do with airborne. So I think the best option here is blood transfusions. A wheeze is commonly heard on auscultation. Let me take that again. A wheeze is commonly heard on auscultation in which of the following conditions? Choose the correct answer. A. Acute asthma. B. Pleural effusion. C. Pneumothorax. And D. Pulmonary edema. I think it is acute asthma. Hematemesis refers to what condition? Choose the correct answer. Heme, blood, temesis, and vomit. Option A says blood and sputum, no. Blood and vomit, yes. Blood and stool, no. What would be the one in stool again? Hematuria is blood and urine. When caring for patients at the end of life, if a family reports that they are concerned that the patient is suffering from dehydration, what action is taken? Choose the correct answer. A. Advise the family this is a common symptom that is unable to be resolved. B. Ensure subcutaneous fluids are commenced. C. Ask family to encourage oral fluids. And D, start measuring the urine output to diagnose dehydration. I think this is a little confusing because someone on end of life, we have to take note of their urine output anyway. So I'm doubting between B and C, but I'll just go with B. I'll just go with B and flag for review. Okay, so for what clinical condition would a patient be on clozapine? Choose the correct answer. A says psychosis in Parkinson's disease in patients unresponsive to homeopathic therapy. B says psychosis in Parkinson's disease in patients responsive to conventional antipsychotic drugs. C says schizophrenia, including Parkinson's disease. To be honest, I'm not too sure because I'm not a mental health trained nurse, but I think it should be C. It should be C when like in advanced conditions or when they are unresponsive to other antipsychotic drugs. So those who have been diagnosed with postpartum psychosis are seen within which group of patients? Choose the correct answer. I don't know. These options are kind of weird. Option A says women who have given birth. Option B says the older person over 75. C says children under the age of 18. And D says neonates. So of course it's only women who have given birth. The 5-year forward view explores mental health provision for the following of the United Kingdom. For the population, let me take that again. The 5-year forward view explores mental health provision for the population of the United Kingdom. Which statement reflects the prevalence of childhood mental health needs in the UK? Choose the correct answer. Option A says half of all mental health problems have been established at the age of 14, rising to 75% by age 24. Option B says all mental health problems are established by the age of 5, rising to 50% by the age of 18. Option C says all mental health problems are established at the age of 14. Option D says mental health problems cannot be established in childhood. I think mental health problems cannot be established in childhood. It would be difficult. Okay, next question says a mental health nurse is supporting a patient at risk of suicide. When is the risk highest? Choose the correct answer. A, at busy periods on the ward. B, after assessment by the consultant psychiatrist. C, prior to discharge. D, in the transition from continuous to general observation. I think that should be busy periods on the ward because, the nurse may lose sight of her or him and be busy with some other things. What can assist in minimizing the risk of violence to staff in mental health services? Choose the correct answer. A says single point alarm systems. B says behavioral therapy training. C says de-escalation training. And D says mindfulness training. I think it is de-escalation training. Okay, so we are through, guys. We got 45 correctly and 5 incorrect. So let us review those ones that we got incorrectly. Oh, I knew it. Why did I? It should be cervical. So the human papilloma vaccination prevents which disease? Should be cervical. I don't know why I keep messing it up with ovarian. And this one should be, is it administering immunizations? So this one should be supporting the physical and emotional growth of a child. So this one says, who should be notified when attending hospital with a school child aged 8? So that should be the school nurse, public health, community nurse team. I knew it. I wasn't so sure. So this question says, motivational interviewing is best described as dash. Choose the correct answer to complete the sentence. So definitely not a tool used in appraising staff for development. So it should be a method of assisting people with health behavior change. Yeah, that was right. That was right. So I don't know about this, to be honest, because I'm not a mental health nurse. Oh, okay. Let me just check them again. So 48 says the 5-year forward view explores mental health provision for the population of the United Kingdom. Which statement reflects the prevalence of childhood mental health needs in the UK? Choose the correct answer. So it is that half of all mental health problems have been established at the age of 14, rising to 75% by age 24. So that is it. Then which question was left? I can't remember the question that missed earlier. That motivational interview. Oh, this is it. Okay. So it says motivational interview is best described as a method of assisting people with health behavior change, just to emphasize on that. So, and that is it, guys. Everything is cleared. We got 45 over 50, which is not too bad for someone who is not a mental health nurse. So if you enjoyed this video, make sure to give it a thumbs up, comment, like, share and subscribe. Share with your friends who you know will find this video helpful, and I hope to see you in subsequent videos. So until next time, bye.